Hi, my name is August Tusher, and this is Tyler Tusher. And you probably recognize us from the One in a Million film that was done with the Penelope program. We are just so thankful to be a part of the Penelope program. We went 7 years without any answers of what was happening to our child. And within a few months of being part of that program, it has changed our life and given so much brightness to our future. We know that if families like ours have been touched and our lives have been changed forever, that theirs can be too. And we are just so thankful for all the people that have donated for this research to go forward. And we are just so grateful and so thankful to be a part of the Penelope program.
This Giving Day, help us imagine more together.
I'm sitting here racking my brain about how I could potentially make fun of myself or edit that I forgot that UDN was the Undiagnosed Disease Network. Wow, what a flub. I'm just going to do a fake recording in as if we were doing this fresh. If I cannot come up with a clever way to humiliate myself without losing respect from the viewers. Thanks for joining us for another segment of Heat and the Helix. Today, we are joined by Dr. Lorenzo Botto. You may recognize Dr. Lorenzo Botto from One in a Million. He is a pediatrician and medical geneticist here at the University of Utah, a professor of pediatrics in the Division of Medical Genetics, and he's also the director of the Penelope program, which One in a Million focused on. Today, we're also joined by Fat Dog's flavored sriracha, and this time it's the sweet, creamy garlic. We neither of us know if it's delicious or not. We don't know how hot it is. Neither of us have tried it, but we're about to dig in there. Dr. Botto, thanks again for joining us, and just want to see what your thoughts are on the hot sauce and how's everything going over there.
Well, we'll give it a try, and thanks for having me and for highlighting the Penelope program. We are really passionate about it, and I look forward to sharing some of the ideas and the work that we've been doing so far.
Fantastic, and I'm looking forward to it too. But as you'll find out with the rest of the series, we got to do something first. We got to eat some hot sauce. So we're going to go ahead and put this sweet, creamy garlic hot sauce on.
Give it a try.
Food of our choice. Cheers when you're ready.
Cheers.
I got the title right there.
Quite nice. I thought it was going to be mild, but it's less mild than I thought. So I hope we can get through this.
That's ominous. Ominous for the rest of the series. And for the folks at home, anyone who doesn't really know much about the Penelope program or perhaps hasn't seen One in a Million, could you give us a bit of a background on what the program does and how the bigger vision of the program has led to where we are today?
Yeah, the Penelope program started a few years ago to tackle a really important problem, both for families as well as for, if you will, the healthcare system. There are families out there that have children or adults. There are many adults out there that really have been going through sometimes years of diagnostic odysseys. They have something that's really significant, affects their care, affects their lives. Sometimes these conditions can be life limiting, but nobody can find the answer to the question, what is this? And how can we manage it in the best way? And these are what we call the undiagnosed diseases or undiagnosed conditions. So we decided to put together a team that brings together sort of the cognitive expertise, the knowledge of different specialists, the knowledge of clinicians, of data scientists, of molecular geneticists, of developmental biologists. And we realize that this is not only the most efficient way, but probably the only way to get at the bottom of these big questions. And so that's what the Penelope program is, if you will, this think tank of people who are passionate about care, about science. And it's a team that works in partnership with families to try and make progress, let's say, quickly and get at the bottom of this, so this diagnostic odyssey can finally find a resting place, a firm ground upon which to build comprehensive management and care, and also further the course of scientific discovery.
From our other conversation, I was hoping you could talk to the audience about what it is that makes this program different here in Utah, and why is it that we are so unique in our ability and so well equipped to address these issues in medical science?
Yes, in order to solve these, we have to begin by sequencing, and by sequencing I mean we look at this person's DNA and scan it very, very carefully. That is the sequencing process. But the sequencing is an important part, but only one part of the puzzle. The sequencing is a book, it's a file, it's an app that shows you something. But in order to make sense of it, to read it, to see what it means in the context of a child's life, you need to pull together people from various disciplines. So this is what I mean by, yes, sequencing is key, that's the starting point, but it's only the starting point. We need to do all of this. And that's why I think Utah is in many ways uniquely equipped to go through all of these steps, each of which builds upon each other. Here we have all of these types of expertise. We've got a world-famous human genetics program, developmental biologists, data scientists, clinical geneticists, and importantly, we have a passion for collaboration. I think many of us truly believe that what we do in this program is the trace we leave in the world, and that is what leads our efforts. We do this for the families, for care, and we do this to advance science. The science we make in partnership with families is something I truly believe will make life better for all of us. It builds the knowledge that can be applied to more common conditions and to the way that we live in the world in which genes and environment all make their impact.
Would you be able to talk about what that future looks like to you as it relates to the general public, folks with healthcare, folks without healthcare, people with common diseases, people with rare diseases? Because I think that really, this program really drives home what that could look like as it stands right now.
We are well equipped as a healthcare system to deal with common conditions, but not with these rare or new conditions. So that's really sort of the main focus is care, but also science. And why science? Because in this challenge, in this pain, in these life histories, are hidden treasures for all of us. It's an opportunity for discovery, for new knowledge, sometimes on entire classes of mechanisms. So the entry point may be this unique condition, but it's like opening a book entering into a cave of treasures in which these families, through their efforts, help us get into, and through them we can uncover things and riches that can help us all. So that is one question why we are passionate. We are passionate to help. We are passionate to discover. We also see this in a way as a lab of innovation. This, I mentioned the culture of collaboration. And it's not a culture because it's nice to have, it's a culture of collaboration because we need it to solve these issues. We have strayed away because of how the healthcare system is. We have strayed away from the team approach in which we all sit down around the same table, currently around computers through Zoom meetings, but we actually speak to each other. We bounce ideas back and forth in real time. And this way of doing medicine is, I think, nowadays a novel way which we apply in undiagnosed diseases and which I think can be very helpful in other medical disciplines as well. If I can summarize this, it is passion, it is hope, it is commitment to the long term because it's not easy. It is partnership with families, and it is a culture of collaboration across multiple disciplines.
I can't think of a better way to end this segment than that. Thank you so much, Dr. Botto, for joining us. And thank you to the viewers at home for joining us as well. If you'd like to support Dr. Botto and the Penelope program, please donate this year to You Giving Day. The Genomic Medicine project this year is the Penelope program. And we look forward to joining you again with our further recordings. Again, thank you so much, Dr. Botto.
Thank
and
you.
You're more than welcome, and I hope you're all doing well out there. Stay tuned.
To learn more and hear the full interview, follow the audio-only link in the description below.
As an alum of the College of Fine Arts at the U, I benefited firsthand from a rigorous arts education where I was challenged to strive toward creative excellence. I emerged from my time at the School of Dance ready to face the working world with confidence in my abilities and ideas. The College of Fine Arts is more committed than ever to expanding resources, opportunities, and access for students pursuing degrees in the visual and performing arts. Our community depends on creative minds to lead the way, whether as artists, scholars, or educators. It is a crucial time to support student scholarships that not only help students enter college, but retain them through graduation. This Giving Day, we are asking for your support to ensure a vibrant future for promising fine arts students. Help us imagine more art, more innovation, more creative leaders together.
This Giving Day, help us imagine more together.